Well, it happened so fast because we thought that we were going home for a couple of weeks. And we went home on a Friday afternoon, and hospice started that Saturday morning. And by Saturday evening, she had dropped into that light coma.
Terry Brewer's 37-year-old daughter, Nicole, passed away from breast cancer, and just weeks before, Terry was diagnosed with breast cancer for the second time in 9 years.
It was Lynn had introduced me about the genetic testing, and how I wished that I had done it 5 years ago, and it might have made a difference in my child's life.
Research shows that knowing your family history and early detection can greatly reduce the risk of developing hereditary cancers.
They said for all the pieces to come together and them to see how a family is affected genetically, it was important for her to be tested. And that would give a truer picture for my children.
Rather than requiring a blood sample for genetic testing as they have in the past, the new oral rinse process releases cells in the lining of the mouth. The sample is then processed in a laboratory to obtain DNA for analysis, and results are returned within 2 weeks.
There's certain red flags that we look for. One, did they develop breast cancer before the age of 50? Has someone in your family had bilateral breast cancer? Did your mother or sister have ovarian cancer?
Terry continues to stay strong with the help of her family and her faith, and wants to help educate others on the importance of genetic testing.
Just not quite, you're never ready. You never want to see your child take that last breath. And that's why it is important to do whatever you can to prevent this.
In Dothan, Gina Pitisci, WTVY News 4. Dothan native Melinda McClendon has a long history with Southeast Alabama Medical Center.
This hospital means a lot to me. Every major event, major event in my life has happened here. I've delivered my children here. My only other surgery was here. I was born here.
Looking back at her first surgery at 5 years old, Melinda remembers how important patient care was to her then.
When I came in for surgery that day, my fingernails and toenails were painted red, and you cannot have surgery with painted toenails and fingernails. So the nurses took my polish off, and when I awoke from surgery, they were sitting in my room with a bottle of nail polish next to my bed, and they painted my fingernails and my toenails again.
In September of 2009, Melinda was diagnosed with stage 3 advanced breast cancer, and doctors say that same standard of patient care Melinda has received throughout her life is more important now than ever before.
Patients do better when they're comfortable, when they have the support system, and that's always going to be close to their home.
Clinical trials and initiatives will be administered right here at Southeast Alabama Medical Center, allowing patients to stay at home rather than traveling to Birmingham for their treatments.
It just makes sense that if your family and your friends and your church support is there with you, the journey is going to be easier.
It's kind of like traveling. It's not really where you're going, it's who you're going with that makes all the difference.
In Dothan, Gina Pitisci, WTVY News 4. When it comes to detecting and diagnosing cancer, technology is constantly improving.
With the new CBCT capability, that's the computer tomography capability on our Trilogy machine, we're able to actually tell the patient throughout the treatment if they're progressing. We've never had that capability before.
Physicians and nurses can now import patient scans and access them through a centralized computer system at Southeast Alabama Medical Center. Also, if patients have had scans at other institutions out of town or even out of state, many times those scans can also be uploaded into the planning system.
We've had MRI, we've had CT scans, and we've had PET scans for a long time. And in the past, I'd say decade, we've been able to incorporate a lot of those just diagnostic scanning procedures in our treatment planning, because that actually allows us to localize the targets.
New advances in radiation and imaging therapy, such as this linear accelerator, allow physicians to attack tumors more precisely.
We have better treatment outcomes because we're able to define the treatment volumes better.
Barbara says that even though she works behind the scenes, one of the most rewarding parts of her job is seeing patients come back and noticing that they have benefited from the treatment given.
We've given them more time, we've given them a better quality of life, and they're also very appreciative of that, and that makes me feel like my job is that I'm doing what I need to be doing.
In Dothan, Gina Pitisci, WTVY News 4.
There was a spot on my leg. It'd been there for years, never thought anything about it.
Sarah Hughes was diagnosed with stage 3 melanoma on June 3rd of 2010. She was only 25.
I had a total of, I believe it was 34 places removed, 8 of them being melanoma, and then also that it was in my left leg lymph nodes.
According to physicians, melanoma is the most common malignancy in young adults from ages 25 to 29.
We are seeing an epidemic in melanoma. It's definitely on the rise.
Sarah says at the age of 16, she was visiting a tanning bed at least 3 days a week and also laid out in the sun with minimal or no sunscreen protection.
You've got to think, you're getting in that tanning bed 3 or 4 times a week at 20 minutes. You know, if you do the math, I mean, it's not good.
By protecting your skin, you can drastically reduce your chances of getting skin cancer.
The most important factors are vigilance, so self-monitoring, self-exam for changing moles, moles that are asymmetric, moles that have an irregular border, moles that are larger than about 6 millimeters or the end of a pencil eraser. Just take care of your skin, and because it's not just a cut and go process. It's the rest of your life process. You have cancer, that's it.
In Dothan, Gina Pitisci, WTVY News 4.